Thank you and good morning, everyone. We will start our meeting today with our land acknowledgement. We, Muskoka Algonquin Healthcare, excuse me, acknowledge that we are situated on the traditional territory of the Anishinaabe. We wish to deepen our understanding of the culture of the local Indigenous communities to develop appropriate, culturally safe healthcare services by building trust through respectful relationships that acknowledge past harms and mistakes to move forward in the spirit of the truth and reconciliation based on the 7 grandfather teachings. So hello to everyone, and thank you so much for joining us today. My name is Maureen Miller. I'm the chair of the board of directors of Muskoka Algonquin Healthcare. And thank you for joining us to learn more about a topic that's been taking up a huge amount of time and gaining some real excitement in the community about Muskoka Algonquin Healthcare, our strategic plan, and our 2 new hospitals. Planning these hospitals for the future is really important because it leaves a lasting legacy, and a legacy that we and our kids and our kids' kids will ensure that we have the very best, excellent healthcare continued close to home. Our team is here today to give you an update on the capital redevelopment work that we're undertaking, and we've been very busy since we last spoke to many of you in January. We're looking forward to updating you today on what we know, and we're also going to be really frank about what we don't know yet, what we have yet to complete, and there is still some work ongoing. So this information is an update and not a final decision. I can't stress that enough, that we're still doing work and we are still hearing from our communities across the catchment. So it's really important to know that as the site selection especially progresses, there'll be continued dialogue and more discussion before that's finalized. So if I could have the next slide, please. Our agenda today has 4 sections. The first one is an update on our capital redevelopment from, excuse me, our President and CEO, Cheryl Harrison. The second piece, we're going to have an opportunity to hear from our foundations and all the great work that they're doing as part of the fundraising for our new hospitals. And we'll cover the highlights of the preliminary evaluation of the 5 properties identified during the site selection process for the South Muskoka campus. Following today's presentation, we're going to open up the mic and give you an opportunity to ask us questions and to clarify things that we may have covered or things that we didn't cover. So with that, I'm going to turn it over to our President and CEO, Cheryl Harrison, for her update on capital redevelopment.
Thank you very much, Maureen, and welcome to everybody as well. I just, it's been great. This is our last virtual session, and we've been out to all our communities in person. We've had 2 virtual sessions, and it's been amazing to see the passion and excitement about our new hospital with 2 sites. So what have we been up to over the past 2 months? Well, we've been doing a lot of sharing of information and listening to all our stakeholders internally and externally. Our last community open house, we had over 400 participants that we met with. And then we also had another 180 folks that had a look at at those meetings to get up to date. What's been really delightful to see is that we've had almost 5,000 unique visitors to our redevelopment webpage for MAHC. And all of these numbers really show, again, the engagement and passion that folks have on this project. Next slide. So this slide, again, I've told all our audiences, you'll probably get tired of seeing it, but what's exciting is that you see the process that we're going through and how we're moving through each of these stages. So as a reminder, the work that we have been doing has been related to functional programming, site design, local share. Those are the 3 components that we have to have into the ministry with stage 1.3. So what's new since the last time we spoke is that we actually have dates now. When we showed this slide before, we were still waiting from Infrastructure Ontario to put dates to our build and to our project. And so about a month ago, we did get dates. We've got dates to complete the detailed planning between 2026 and 2029. At 2029 is when we hope to have shovels in the ground. 2027 is a milestone opportunity as well for us, where we can actually go out to tender for construction. And that can take about 2 years before we can actually start the construction. So that was a really important milestone, and we're very excited and happy with that information that we got from Infrastructure Ontario. Next slide. So a big piece of the work that's been going on the last few months and will be going on into the summer and the fall is creating a functional program. And that involves what we call user groups, and we have 16 user groups, and they have all met once. There'll probably be another 5 to 6 meetings at least, with our consultants going back and forth as we start to take a look at what we need in the different areas. So for example, with the emergency department user group, there's staff, there's EMS, there's patients and families that are there, and they're looking at not only what we're doing today and what the challenges are, but what do we envision we want to be doing 10 years from now? And so in order to inform some of that, obviously, we look at a lot of data. We look at population projections. We take a look at, best practices that others are doing that we're not there yet. So when all is said and done, after the user groups have had these discussions and have what they think a functional program would look like for an emergency department, we give all that information over to our consultants from Stantec, the architects, who then can start to take a look at the footprint of of the future hospital sites to decide how these services are going to fit in. Next slide. As you can imagine, these type of discussions and future planning, we really have to be innovative. We really have to look differently. And as a result, we want to make sure that we're using good principles for our planning. One of the principles is about being community-based and how important it is for our communities to have not only the hospital services that they need, but how those hospital services connect with other community-based services, because we all know that the visit to the hospital is episodic, and there's lots of other health services that are needed around us for the health of our patients. We always want to be patient focused. This, from a patient's perspective, there's lots of learnings in what our planning can look like, what we want to keep, what our patients and families think we should be doing differently in the future. Sustainability and affordability is also an important planning principle, and been very good to hear the validation through our communities sessions. Sustainability, not only for the size of the building so that we don't have to turn around and try to build another hospital because we've outgrown it. Sustainability about how we're building it. A lot of great support for taking a look at, our carbon footprint in these buildings and what we're going to do to add value to that. Affordability obviously is an important principle that has come up as well. We are going to be making sure we're building to what we need and not overbuilding, because we have to think about how we're going to continue to pay for the operations of the organization. So we're always looking at that as a principle. And then lastly, and probably more importantly, is that our planning reflects our mission, vision, and values. And I'm so proud of this organization, because our mission and vision and values aren't just something that are on a wall. We use them on a day-to-day basis, and planning of this magnitude should be no different. Next slide. This is just a little bit of a recap of how our user groups are working. They're using projections, population, as well as having subject matter expertise. And that subject matter expertise, as I said, comes in forms of the people that do the work, the people that support the work, and the people that receive the work or care that we give. And as I said, these are iterative collaborative workshops with our consultants. So they also are going out, they hear what we say, they come back, they gather information about what other organizations are doing, and help give us the information so we come up with the best possible plan for that area. Next slide. And then finally, you're going to hear about site selection, which is a component of stage 1.3. But the other important piece of 1.3 is that we do have to give in our submission a financial plan for the local share. And at our last session in the communities, we shared the $225 million goal that has to be raised. And, you know, under Maureen's leadership, she is chairing a local share committee that involves our district, our municipalities, our foundation, and we've even had other municipal partners that have stepped up that are outside of the Muskoka area, like East Perry Sound and Almaguin, who also want to be part of supporting, from a funding perspective, the local share. We are very, very confident in the work that is happening to date. We're not ready yet to release the plan. Still more conversations going on, but we are really, really in a good position. So that is my update. I'm now going to hand it over to Leah Walker. She is the Executive Director of the South Muskoka Hospital Foundation, and she's going to give you a bit of an update on how the two hospital foundations are doing with the campaign.
Wonderful. Thank you so much, Cheryl. Good morning, everyone. Again, my name is Leah. I'm the Executive Director for the South Muskoka Hospital Foundation. Thanks so much for tuning in this morning and hearing an update on some of the great work that's been happening. So as most of you are probably aware, Muskoka Algonquin Healthcare operates two sites, one in Huntsville and one in South Muskoka. And we're very fortunate because with that, we have two hospital foundations that are each working hard to raise funds for their respective site. At the foundation, our primary goal is to raise funds that support patient care. And that means new equipment and technology, facility renovations, as well as staff education and staff well-being. A lot of people, myself as well, are very shocked to learn that the equipment in a hospital isn't funded by ministry dollars. So while the government pays for the basic operating costs of a hospital, virtually every piece of equipment throughout it is paid for from donor support, which is pretty incredible and pretty impressive when you think about all of the tools and technology that we have in our two hospital sites. We are very fortunate throughout Muskoka that we have such generous and supportive communities that very clearly value quality healthcare and healthcare close to home. And that generosity and that excitement is what is really driving us and getting us excited about this future planning and making sure that we've got incredible new hospitals down the road. And as we do that planning, we're working closely with our partners at the Huntsville Hospital Foundation. And we're looking for ways that we can collaborate, make sure that we're streamlining our approach, finding efficiencies, really to ensure that we're both successful in this project. With that being said, of course, donors will be able to direct their support to the hospital if they're choosing, as they've always been able to do. And next slide, please. Thank you. So both foundations have made a commitment to fundraise for the new hospitals, and both have already established a fund to do so. So we are very excited and ready, and we know we're going to be successful with that. In addition to planning for the future and the long-term needs of our community, we also are committed to making sure that we've got great care right now, so that when patients come through our doors, we've got the tools and technology that we need to care for them. So in addition to fundraising for the future build and setting aside funds for that, we are also committed to fundraising for the annual equipment needs of our respective hospitals. And we're able to do that because we have such generous communities. And we're very confident in our that we will be successful. And it's because of our communities and because of you that are joining us here today. And next slide. And if that piques your interest at all, and if you are wanting to get more involved in the future planning and in this incredible opportunity that's coming to Muskoka, we will be doing a lot of campaign planning. We will be developing our campaign cabinet. We'll need strong volunteer leadership and ambassadors within the communities that want to step up and help out. So I encourage you, if that's of interest to you or of interest to someone you know, to reach out to myself or Catherine in Huntsville. And just in general, if you have questions or comments, we are always wanting to connect with our community members. So please reach out anytime, and we'd love to chat with you. and very much look forward to keeping the community involved and informed as we move forward with this exciting project. Thanks so much.
Thanks so much, Leah. We are so very fortunate to have two hardworking foundations leading us in our fundraising efforts for these two new facilities. Through COVID, we have seen a really strong support for both of our foundations, and we realize that our foundations can go head to head with many other foundations in communities that have bigger populations than we do. So we're in a really fortunate place there. So Leah, thank you for all the work you and your foundation do for us. It's we're going to be really counting on you in the future as we do today. So the next part of today's presentation has been a big part of the work that we're doing, that we have been busy with since we last talked to the community in January. The current site for the South Muskoka Hospital is too small to accommodate future development. And today, we're going to share with you the work to date on the search for a new site. Please know that this work is not complete. We still have additional work to do, and we are moving forward with that in addition to gathering input from our community once again. So the consulting team has been working hard to gather the data and assess various sites that are being considered. And this morning, we're going to share the results. We're also sharing what we don't know yet and what is still left to do. So to walk us through that work completed since January, I'd like to introduce James Giapallo from Urban Strategies, an urban planner with that firm. And he's been working very hard on completing the site assessment with help from the larger consulting team. So James, over to you.
Thanks, Maureen. Can everyone hear me fine? Great. As Maureen mentioned, my name is James Giapallo. I'm a planner at Urban Strategies, and we are the land use planning firm that has been working with MAHC along with Stantec over the past 5 months on the site selection. Since January, our work has included further conversations with stakeholders, identifying additional sites for evaluation, undertaking hospital test fits to demonstrate how a hospital might fit on a property, undertaking the assessment, and then preparing a draft report for MAHC. So today I will walk you through the preliminary evaluations. Next slide, please. The ministry's capital redevelopment process requires that site selection take into consideration the perspectives of various stakeholders. This slide just gives a taste for the range of conversations that we've had with different folks, planning and engineering staff at the town of Bracebridge and the district, emergency service providers, MAHC staff, physicians and volunteers, the hospital foundations, the Indigenous Leadership Table, for example. And as Maureen mentioned, there's still work to be done. We're having ongoing conversations with municipal and district staff, NAV Canada and Transport Canada, as well as with the community, with this virtual session being our last open house. Next slide, please. So over the course of the project, we've identified more than 20 potential properties for assessment. Many of those came about through the open houses as well as the online feedback survey. We compared those against our pass-fail criteria, the absolute must-haves for a hospital. The site must be a certain size. It must have relatively good access to servicing. It can't be within the floodplain, for example. So there are 5 properties that were determined to meet these pass-fail criteria. And these are 300 Pine Street, which is located between Home Depot and the fairgrounds on the east side of town. 1975 Muskoka Beach Road, which is just opposite Muskoka Brewery. The Highway 118 Westlands, which is C on the map, and that's between the Muskoka Retirement Villa and a property known as the Fife Farm. D is 709 Ecclestone Drive, which is just opposite the Fenner Dunlop facility at the interchange of Highway 118 and Highway 11. And then 28 to 72 Kirkhill Drive. Kirkhill Drive extends from Ecclestone Drive. It's a business park area. You might recognize Climb Muskoka as well as a few other businesses in there. Next slide, please. So over the course of the process, we developed site selection evaluation criteria, and these fall within 3 buckets, the first being location and property. So assessing the appropriateness of each property for a hospital facility, as well as looking at the broader context for how compatible a hospital would be. The second is land use planning framework. So assessing the appropriateness of a hospital based on provincial, district, and municipal policy direction. And third, capital and operating costs. So the cost efficiency of developing a hospital at each of these locations, considering land costs, the costs of building and extending services and roads, for example, as well as environmental remediation if that's required. So through stakeholder and community engagement, we learned that not all of these categories are equal. Some are more important than others. Location and property represent 50% of the total evaluation, capital and operating costs 37%, and then land use planning framework is 13% of the total evaluation. Next slide, please. We've also adapted the criteria over the course of the project in response to what we heard from the community through the open houses, as well as the online feedback survey. In a couple cases, this was adding new criteria, such as a criterion for accessibility for cyclists and pedestrians. So not just accessing the hospital by a public transit or a private vehicle. We also added a criterion related to proximity to downtown Bracebridge, recognizing that there are some benefits to locating a major institution near the core and the synergies that can create. And then in a couple cases, we've tweaked or expanded on existing criteria. So we heard loud and clear that the environmental impact of development is important. So we've brought that to the forefront of the evaluation. And then this notion of protecting natural landscapes. So we've expanded a criteria related to natural landscapes to include avoiding excessive clear cutting, for example, where possible. Next slide, please. In terms of the mechanics of the evaluation, each property is scored between 0 and 1 based on how well it meets each of the criteria. We've recognized that not all criteria are equal, so we've weighted these between 1 and 7. So through all of our discussions, we heard that a location very close to Highway 11 is critical for a healthcare facility that's serving a large region. So we rated that very high. On the other end of the scale, one of the criterion is natural features or other features that enhance the experience of accessing healthcare. So we looked at natural settings, views and vistas, that sort of thing. Those aren't critical to the functioning of a hospital. They're nice to have, and they can definitely be built into the site plan and landscape design of a hospital. So we rated that fairly low, just for reference. So the score for each criteria is multiplied by the weighting, which gives it gives a total point for each criterion, which are then just totaled for a score for each property. Next slide, please. So now I'll just walk through the 5 properties that we assessed and highlight some of the high-level strengths and challenges that we looked at. The first is 300 Pine Street. It's close to downtown. There's no further environmental site assessment work that's required based on an existing study. And the property has a low land valuation based on the town of Bracebridge's purchase sale agreement for the property. Challenges include significant grading along the west portion of the site, related to its previous use as a sand extraction site. This creates some challenges for future expansion or replacement of the hospital in the longer term. There's also some considerations related to road access, extending and upgrading Depot Drive and Pine Street, as well as the construction of a new street to provide secondary access. And then construction challenges related to the soil composition and the need for clear cutting on the east side of the property. Next slide, please. 1975 Muskoka Beach Road. It's a fairly flat site, which makes laying out a hospital quite efficient. There are lands in the surrounding area that can support complementary uses towards this idea of a campus of care. Relatively easy site access with relatively minimal upgrades to the existing road network. No obvious environmental concerns. In this case, the property is part of a larger land holding, and the piece of land that we've delineated for this study was purposely done to create a buffer to environmental protection lands that are located to the north as well as to the west. And it's a service site with services along its frontages. In terms of its challenges, there's some archaeological potential that needs to be explored related to a historic homestead on the site, working coordination for hydro servicing, some coordination to determine how secondary road access would be provided. And then the property would need to be severed from the larger land holding, which is a standard process. Next slide, please. Highway 118 Westlands, again, it's a flat site, so it can be laid out quite efficiently. And with the creek and ravine, we walked the site, and it's a very attractive setting for a hospital. Challenges include its location. It's a little bit off of Highway 11 and would require many people to drive through what's a busy part of town. And this property is designated for longer term residential land supply in Bracebridge. So there's a question about whether it's a good long-term planning decision to remove that from residential use. It requires extensive servicing and road upgrades. The hospital would have to be laid out on the southern portion of the site, south of the creek. So you can imagine the work involved in terms of providing access and servicing to that back half. And then a relatively high land valuation based on its existing zoning and official plan land use designation for residential use. Next slide, please. 709 Ecclestone Drive. Again, it's a flat site. It's very close to Highway 11 and has a relatively low land valuation. Challenges include the lack of servicing. They don't extend this far. Compatibility with the surrounding uses and the industrial zoning in particular. This property also has archaeological potential that would need to be explored. And in this case, secondary vehicular access is not possible given the existing context of streets and roads. And lastly, it conflicts with the airport. Muskoka Airport, located just to the south, has designated approach zones that make it complicated to build a hospital, including the helipad that would be needed to support a hospital. Next slide, please. 28 to 72 Kirkhill Drive. Strengths include no further archaeological study required based on an existing study. Relatively good access to Highway 11 and a service site. Challenges include its industrial zoning, similar to the previous property. Secondary vehicular access is not possible, given the river to the east, as well as the rail corridor that separates the property from Ecclestone Drive on the west. The property is highly irregular in shape, so there are parts of it that can't reasonably be used for a hospital and the supporting uses, and then a high land valuation relative to the other properties. Next slide, please. So this slide shows an overview of our preliminary evaluation results. There are 3 properties that we consider suitable for a hospital. 1975 Muskoka Beach Road, which we consider the preliminary preferred location as it's scored the highest in the evaluation. 300 Pine Street and Highway 118 Westlands. And then the other 2 properties are no longer being considered for the hospital, and those are 709 Ecclestone Drive and 28 to 72 Kirkhill Drive. Next slide, please. Maureen mentioned that there's still work to be done. So we're having ongoing conversations with district and town planning and engineering staff. And this will include a detailed analysis of the required municipal services for the 3 highest ranked properties. NAV Canada and Transport Canada are confirming the impacts for each of the sites related to Muskoka Airport operations. Overall, we expect that this analysis and these conversations to validate the current assessment as opposed to impact or change the overall rankings. Next slide, please. As I mentioned, further conversations with the town of Bracebridge, and then a series of reports and studies and drawings that would be required for the preferred location, which would include a detailed site plan, technical, geotechnical and hydrogeological reports, phase 1 and 2 environmental site assessment reports, topographic and legal surveys, an infrastructure report, and then more detailed cost estimates. And I believe that is my last slide, so I'll throw it back to Maureen.
Thanks very much, James. That is the last slide, and we are at the end of our community engagement for this round. We're in our last virtual meeting today on April 26th, but we invite everybody to stay informed and go to the website so you can subscribe for updates. We're trying to communicate as quickly as we can with new developments as it moves forward. We are totally open now at this point to answer any questions that anybody may have. And again, I would ask you to use the Q&A session at the bottom of your screen. And if you don't have a Q&A, then you can just use the old-fashioned hand option to do that. So we're watching the screen and happy to answer any questions you might have. Because we have quite a few people on the call today, it takes a little while for everybody to, oh, there I see we have a question. Allison, you're going to read these out, correct?
Absolutely, happy to, Maureen. Thanks for our first question. How long will construction take once it starts?
Okay, I am going to take a crack at that. We're hoping to have shovels in the ground 2029. It will take quite a significant amount of time to tender this project because it's quite a big project. We hope to be turning some sod over at both sites in 2029, and we hope to be approaching substantial completion sometime around 2032. So as much as that seems like 9 years sounds like a long time away, it creeps up on us pretty fast. So that is the anticipated build timeline right now. And of course, that all depends on the Ministry of Health and Infrastructure Ontario circling back to us after we've submitted our drawings. And timing wise. I see a few more coming in, so back to you, Allison.
Thanks, Maureen. Next question from Randy. Thank you for your question. How close is the Muskoka Beach Road site to the Muskoka College? I think that's the college that's been proposed.
Yeah, so the 40 acres that we have been looking at as the preferred location is on the far south part of a very large parcel of land, the northern and western portion of which has been is currently in front of the Ontario Land Tribunal as the development known as Muskoka Royal College. So this will be a fair distance away, but still on the same currently still on the same property, so there would be a severance to take place. Distance-wise, it's hard to answer that question right now because we don't know exactly what the layout of the hospital will be on that 40 acres. We're looking at this point of having it on the most southerly portion of that land, closest to the turn in the road and right across from the Muskoka Brewery.
Go to the next question. The focus was thus far on South Muskoka, mainly I'm sure about the site selection process. Is there an update on the Huntsville Hospital?
Actually, Cheryl, maybe you want to answer that question in terms of what's going on at Huntsville.
Yeah, absolutely. And Karen, thank you very much for the question. There isn't a lot going on in terms of the actual site selection for Huntsville because we can build on the property that we have. So that work in terms of, again, once we know what the site, the hospital site will look like, then we can start kind of putting it in on where on the property it'll go. But it's not necessary that we need that information for this stage of the project. And the user group work that's going on is for both sites. So equal discussion happening in terms of taking a look at functional programming at both of the sites.
Thank you. We'll go to Debbie next. We'll get you unmuted, Debbie, and you can pose your question, then we'll go back for the Q&A.
I wanted to thank you, Allison, for letting me join this. I unfortunately will be moving back to Muskoka in and around that period of time. I do have severe disabilities now. I broke my back in 3 places and I possibly have Parkinson's. So will this hospital, unlike the current Bracebridge hospital, which is limited in regards to testing, will there be further advancements in the new facility regarding CAT scan, MRIs, all necessary treatment accessibility, or will you be still sending them south to Barrie or Toronto or Mississauga?
Debbie, thanks for your question, and we welcome you back to Muskoka when you come back. And I'm going to turn that question over to Cheryl to answer.
Yes, Debbie, and look forward to seeing you back in Muskoka. And for sure, in fact, if you're not aware, we did get an announcement last year for an MRI for Muskoka. Right now it's being, the site of it is in Huntsville, but it's for Muskoka and area. I mean, we've been really championing the need to have in our district closer access to MRI. You're absolutely right. It's become kind of basic diagnostic tool as well as CAT scan. So all of those things will be planned for the future. And likely at that point in 10, 15 years, MRI will be like a general X-ray machine. So we will likely be looking at having one at both sites.
Oh,
you're on mute, sorry.
Will there be an addition to bringing in specialists and physicians? Because we have a lack, we've had a lack all my life in part of Muskoka. So moving home for me is not by choice, it's by circumstance. Secondly, I won't have a doctor when I move. So that's what I'm saying is, will there be a change or an option to bring more physicians and specialists northbound?
And those discussions are happening at the user group about what our needs are going to look like in the future. And so even conversations like this will be very important. We've only had one user group for inpatients, and we talk at those user groups. We also talk about health human resource needs for the future. So this has been great information that will inform that group, all those groups around what you're telling us.
I'll just return to the Q&A. Thank you, Debbie. In terms of sustainability, what will happen to the existing Huntsville Hospital? It seems that it could be repurposed in many ways.
So I will start on this, and Cheryl might want to add some comments as we go. The current Huntsville Hospital is slated for demolition. There's a number of reasons for that. Renovations at the Huntsville Hospital continue to be very, very expensive and very difficult given the comprehensive changes to Ontario Building Code since the hospital was still first built in the 70s. The new hospital will be built adjacent to the current one, and where the new hospital exists now will become a level parking lot, so that we won't, many of you who have been to Huntsville know that you have to climb several sets of stairs to get into the hospital from the parking, and that will be eliminated as part of that. There has been a lot of discussion about how to repurpose the hospital building. At this point, discussions and cost estimates to do that have not supported the idea of repurposing that building, but rather to dismantle it and use it for other purposes. Cheryl, did I miss anything there that you'd like to add?
Nope, you covered it, Maureen.
Okay.
Okay, going to the next question from Peter. Do both constructions need to be started at the same time?
Thanks for that question, Peter. This contract will be procured by Infrastructure Ontario as one contract. both builds under one contract. So it will be in large part up to the contractor that is awarded the contract to determine the order of go. But the important thing to remember in a contract that is bid in that manner, with procured in that manner, that substantial completion will not be achieved until both hospitals are fully built. So there will be, the onus will be on the contractor to build those out completely and finish the work before they substantial completion is achieved, and they are then compensated and paid for the remaining for the whole contract. So which one, if one goes first, they both move together. That may not be in the control of MAHC at that time. It will be part of the procurement process as it's developed and tendered by Infrastructure Ontario.
Great, thank you. Another question from Randy. Muskoka Beach Road turnoff at Ecclestone and that railway bridge is dangerous. Will this whole intersection be reconstructed?
The underpass from the CN rail has been discussed. It has been brought up many times by the community. One of the outstanding things that needs to be done as part of the development work at that location would be to do a transportation study to understand how that might be changed or modified in time. I think it's important to remember that that structure belongs to CN, not to the town, not to the district, not to MAHC, but to CN. And at some point in the future, it will have to be rebuilt. And perhaps at that time that will be enlarged, but for the time being, that will be considered as part of the transportation report that's completed as we move forward with that as the preferred site.
Seeing no new questions in the chat at this time.
Okay. So in previous court meetings, this has happened that I've started to say thank you and thank you for joining us, and we really interested to hear from you, and a whole bunch of questions came forward. So I'm hoping that we have an opportunity now. There's a few more people might ask a few more questions. We are continuing to stay busy with this, and again, we'll communicate as much as we can, as early as we can. And I think the important thing to leave you with is that the province has committed to these two new hospital builds. They have provided the funding and have committed to that funding, and that's the prize. What we have to do as a community is to make sure that we get the locations correct, that we get the facilities working appropriately, and that we have good conversations with our doctors, our clinicians, our nurses, all the other people that work in our hospitals. And in the end, we'll have two brand new facilities to take us forward in Muskoka with excellent healthcare close to home. So with that, I don't see any other questions moving forward. So thank you again for joining us today. We really appreciate it, and we look forward to seeing you again. Oh, I see that Debbie has her hand up. Debbie,
Just
another
really
question?
Yeah, just really quick. It's not regards to medical or structure, but you were asking about volunteerism. Once I am back in Muskoka, I won't be physically allowed or physically able to help out. Is there virtual opportunities as well to work from home?
100%. We look forward to any contributions you can make. I think as much as the hospital build, the numbers are big, the local share number is big. There are many, many volunteers that contribute to this. So Debbie, thank you so much for agreeing to volunteer your time. And as a patient of the hospital in past, your voice is very important. So thank you for that. And we have your email as you've, so we'll put you on the list, and we look forward to your help in the future. Thank you so much.
Thank you.
Oh, I see one more question in the, okay.
Correct. We've got, does the preferred site involve a bypass road being built over the Muskoka River?
So part of the discussion that has surrounded this, as you know, nothing is permanent in our communities. Those things are always changing. There has been discussion about a bypass, a Bracebridge bypass, that is being explored and discussed with the town of Bracebridge. As James commented, they're still working back and forth with the town of Bracebridge. That is not part of the work that we're doing, or that we would be involved in the development. But the town of Bracebridge has been discussing that potential bypass. So rather us being able to comment on that or control it, that would fall into the town of Bracebridge. So James, that's on your list to discuss with the town, correct? In terms of any impact that might have one way or the other on the 3 possible sites?
That's right. We've already had a conversation with the town about the sort of the timing and status of the bypass, and the test fit for the preferred site accounts for that. But it's definitely something that we'll be having further conversations about.
Great. Thank you.
Good. At this point, seeing no new questions in the chat, just want to thank everybody for using the feature to pose their questions today. It was really great.
Great. Thanks, everyone. Have a great day, and please keep in touch with us and keep watching for new updates. Thanks again. Have a great day.